Little did she know that a four-wheeling adventure in the dunes of Mexico would land her in the intensive care unit of the very hospital in which she worked. But that is what happened when Connie Rodenhiser, a nurse at UCSD Medical Center, was critically injured in a hit-and-run accident.
And also never underestimate the impact of the lives that you come in contact with on a daily basis. I had no idea that the people I work with would end up saving my life.
The accident left Connie with 3 skull fractures, a broken collarbone and ribs, a ruptured liver, a spine broken in 7 places, and less than a 5% chance of living. She spent a month in the intensive care unit and 3 months total in the hospital.
I just want to say that the trauma unit was absolutely incredible, and I know that my chances were very slim, and I'm real fortunate to be not only alive, but to be a practicing nurse again, which is one of my greatest passions of all, so I'm really grateful.
Throughout her time in the hospital, Connie used the pediatric patients she cared for as inspiration and remembered how hard they fought for their own lives.
No matter what kind of trauma we all have, whether it's physical or emotional or financial or you name it, don't let it defeat you. And for me, it's like I am so lucky to have been able to come back to the person I used to be, and that's because I had to get to know who I was and what my main focus was in life.
So the video you just viewed was a survivor story of Connie, a nurse here at UCSD, who was in a traumatic injury. We recently sat down with her, now 5 years later, and had an opportunity to ask her questions about the patient experience, things that only a patient would know that can help influence how we give care and how we support families and patients in healing.
I remembered periods of in and out. For the most part, I was very well sedated, but I can tell you that I remembered voices and things happening around me that a lot of people didn't know that I knew about. Well, family and friends were very influential in my recovery. They were the ones who knew that there was still a person in there. And by looking at me, you would never know. I mean, I was paralyzed, sedated, and just laying in a bed. And how would you know I was in there? An example of how I looked and how I was perceived is really illustrated well by this note that a patient in the ICU wrote to me and gave to my parents. It goes like this: time seems to stand still here in this hospital room. The hands on the clock have only moved once in the past 4 hours. My mouth cries out not in pain, but in dry thirst from the oxygenated breathing machine that keeps my lungs rising. I twiddle my toes and fimble with my fingers, even glancing to and fro for a quick view that will scare away boredom. And then I see her, the girl across the hall who lives in an atmosphere 100 times different and probably always will be. God, is she alive or just in there? And I, of all God's little creatures, thought I was being put out because I couldn't have a Pepsi today. So that just shows you how I appeared on the outside, and yet I was really still in there. And it was my family who could pull me back with things that they knew about me. They knew I was still in there. Their presence was very important to me. I could feel the energy of them being there, and I knew when they weren't there too. Communication was really important. I really liked it when my nurses talked to me and told me what was going to happen before it happened, and then when they came back to me afterwards and told me how I did. My family and friends kind of worked together, and they made collages of my whole life and put them over my bed. I had some great primary nurses in the SICU, and they made a huge difference in how I felt. And my mom got to know their schedule and make sure that they were there. They were always my nurses when they were on, and they were wonderful. I mean, they got down to my level and they talked to me. They told me what was going to happen before it happened, and we really established a rapport. And to this day, I think a whole lot of them. They were actually really, really good with my family. My mom had a little notebook, and she would ask questions to my spinal surgeon, and he would stop and say, "Joan, did you get that?" And she would jot everything down. So he was very humble, and that meant a lot to my family, and it meant a lot to me to know that they were cared for in that way. Dr. Hoyt was wonderful in just making sure that my family knew what the plan was. He also was very good at talking to me as a patient, and I can remember I was getting close to being extubated and learning how to sprint and everything, and he said, Connie, you need to be on board with us. You need to let us know what you need, and you need to work with us. And I was sitting there being very afraid and thinking I was never going to walk, and I didn't know what kind of life was ahead of me. But he said, you will walk again, but you've got to work with us. And so it let me know that I was still part of the plan, and I was an active member of the plan. My mom also kept a journal to document everything that had gone on. She said later on that it was really important for me. I could sense when they weren't there, and I'd get really agitated and very afraid. But for the family members, it was a bit overwhelming, all the different machines and technologies. And sometimes, people would be really busy and not able to explain things to them. So that was a little bit scary for them. And no one in my family is medical, so just seeing me tied up to all these things, it was very scary. My sister, she mentioned that when she saw me sectioned, she was just horrified because this particular RT was very rough with me, and he almost treated me like I was, she thought it was like he was changing oil on a car instead of taking care of a person. That was her impression. So that was pretty powerful. For me, my experience was that it was very painful, and I almost felt like I was suffocating, and I felt very much out of control, and I couldn't wait till it was over. And I often sat there and wondered when it was going to happen again. If my caregiver didn't tell me, "We're done for now, you're doing a great job," I kind of lived in fear that it was going to happen again. So it's a very uncomfortable experience even when you're paralyzed and sedated. For the most part, it was absolutely wonderful to my family. There was just a few individuals who were short with my family. One person made the comment, how many grown women need their mom at their bedside 24/7? Before my accident, I was very independent. I left home, I didn't look back, I moved to California, but when this happened, I needed my family. They all supported each other, and each person played a different role. My dad was like the peacemaker, and he always kept things calm. There's probably an element of denial in there too. He didn't realize how sick I was. And my other sister, she was the organizer and the taxi driver, and she made sure that everybody knew where we were supposed to be and what was going on with rounds and things. And my other sister she brought some really meaningful things from my childhood and brought a little worry stone for me to hold, and she kept it very sentimental, and she was right there with me all the time, rooting for me. And my brother was he was a strength for us when I actually got out of the hospital, helping my mom carrying my wheelchair and helping me with my therapy and all. So everybody had their own little role. It was very special.
Tell us how it felt to be a patient in the ICU.
Well, I can tell you for the most part, I was definitely well sedated most of the time, but then there were periods of in and out, and those times I was very much aware. And I remember voices over me. I remember how I was moved and touched and talked to. I was basically just laying there, but I could hear things all around me, the hustle and bustle of the ICU. I could hear people talking over me, but not really to me. And that was one thing that I really didn't appreciate, because I wanted to be acknowledged. Yes, if you looked at me, I looked like a person who was just snowed, but I was oftentimes having thoughts and hearing what was going on. Another memory I have is I can remember what all the beeps and the dings meant because I was a nurse, and so I could remember hearing my KO feed beeping and going, oh, I remember those things always acted up. And, you know, remember hearing a beep and I knew my antibiotic was done. And also those beeps and dings were very loud to the patient. They would wake me up sometimes. I remember was after the experience and I had recovered. It was about a year later and I was working on pediatrics, and I was looking at the board and I heard these voices around me, and I heard a particular voice and I looked and I didn't see anyone I knew. And so I just kept doing my work, and then I heard the voice again, and I finally went over and there was a respiratory therapist in the corner, and I just started talking to him and I said, is there any chance that I know you? And then we came to find out that this person had taken care of me in the ICU. Now, I wouldn't have known him from Adam because I never saw his face, but I knew his voice. And he was somebody who always would touch my face first, and he would call me by name, and he would say, Connie, this is going to hurt, but you're going to be better after this. And then he would suction me, and afterwards he would come back to me and rub my face and say, good job, you're getting better. And that was very powerful, a very strong memory. It shows that I remembered a voice and what that voice did for me.
About how your family played a role in reassuring you about things that you were thinking about and that, you know, were bothering you about being in the hospital, and once you realized where you were and what was happening.
Mainly my mom, I think, would just kind of anticipate what I might be worried about, and she kind of reassured me that my bills were being taken care of, that my apartment was cared for and everything was fine. Not to worry about work or anything, that everybody was rooting for me. And then I had a friend who worked at Channel 8, and he organized a fundraiser on my behalf, what was very helpful to hear also. And the biggest thing was reassurance for me, just to let me know that I was doing okay, you know, that I was getting better. You know, it's when you can't breathe or when you're going through respiratory treatments, it's really important for somebody to just say, you're getting better, you're getting stronger. You know, every little milestone makes a big difference and should be celebrated.
What would be one thing that you would share with other nurses about positioning and interacting and all of those things from that patient perspective?
Even though you're paralyzed and sedated, you can feel, and when you're paralyzed, you cannot tell anyone what's hurting, and so just to be hypervigilant about moving me and pressure sores that might occur. Even though what we do on a daily basis, and it can sometimes become routine or seem to be so, it's really important that we don't portray that to the family. You know, their world has been turned upside down. You know, this is very traumatic for them, and they don't know what the next hour will bring half the time. So it's really important for us as caregivers to understand that and to be there for them. You know, acting as if your personal conversation is more important than the question they just ask you, or the fact that they need some pain medicine. Just what we say in passing can end up, you know, we go on to the next patient, on to our next thing, but that word can stay with the patient for a very long time. When I was in the ICU and I was intubated and paralyzed, it was really important for my family to be there. It was instrumental. Just to know that familiar people were at my bedside, people who knew me, people who knew what was important to me and what I was fighting to come back to. And then all along, it was important for my mom to be at my bedside, taking notes, keeping track of the right way to take care of me. She always checked in with my primary nurses and made sure who was taking care of me and who was looking out for me. But she used to say to me, I was reading her journal that she kept at my bedside, and she said that it never fails. Whenever the nurses went to lunch, the surgeons would come by and try to change the dressing without pain medicine. So she took it upon herself to put notes on me. You know, do not touch till you talk to my nurse, and I have some pain med on board. So she was my little fighter. And she fought a lot of battles that I'm sure I don't know anything about. What was really important to me was when people would give me their name, they get to know every private inch of me. Can I just please know who you are and what, and who's taking care of me right now? Especially because I can't see. So it's really important that I know who's accountable for my care. But just important that they talk to me, not at me. I often felt like they were speaking over me, as if I wasn't there, and that was one of the most aggravating things to me as a patient, because I was in there. I knew a lot about what they were talking about. I just had no way to show them or tell them that I was with it at that moment. So I feel like no matter what, we have to assume that our patient's period of awareness is all the time, because we can't tell when they are or aren't conscious or with us. A lot of them, I had many nurses and RTs who are amazing, but most of them, it started with simple things like telling me their name, getting down to my level, and telling me what the plan for the day was. Also, a biggie was pulling the curtain or closing the door and letting me feel as if they were not only protecting me, but any information about me. You know, there's the big team approach, and everybody puts their heads together and we decide what's best for the patient. But what it really boils down to for the patient is the one-on-one interaction. And it's really important that you establish that trust. And once you have that, the patient is more relaxed, and they can trust, okay, she knows what's going on with me, she gets it. And you can relax. One of my physical therapists used to talk to me as a nurse, not just a patient, just a body. She would tell me, you know, you may have had patients with similar injuries, Connie. So not only did she know who I was, but she knew what was important to me and what I did. That meant a lot to me. That was a big factor in my recovery. There were prayer chains from here to Michigan, and I strongly believe in the power of prayer. I did have, when I was really, really sick, I did have a visitor, someone who, my grandma, who's been passed for a while, and she kind of told me that it was up to me which way I wanted to go. I had the choice to come with her, or I could decide to stay. And I knew that that was within my power at that moment. There was a patient named Christian who was very, very sick, and I remember the word was, unfortunately, that he wasn't going to make it. But this little guy fought his way back, and he did make it. And I remember when I was on the ventilator fighting for my life, I remembered Christian, and I thought, if Christian can do it, I can do it. And so he served as my little motivator. It was, you know, some of the courage and the bravery that I witnessed in my own patients sparked my own will to live. And incidentally, when I finally did recover and I became a camp counselor for Camp Reach for the Sky for kids with cancer, he was a camper and I was a counselor. And we sat on a bench and we compared chest tube stories. And I thanked him for helping save my life. To the patient, nothing should seem routine, because what they're going through, their world has been turned upside down. They are in crisis mode. And the last thing they want to be is just another patient, just another diagnosis. They want to be validated for what they're going through, and it's individual for everybody. It's just really important to acknowledge that there's a person in there, that's a person in that bed. It's somebody's mom, somebody's sister, somebody's daughter. It's somebody's child, and we need to treat them with respect and dignity and the best care that we would give our own family member. what may seem routine in a series of operations, you know, my family wanted to celebrate my third liver operation. They wanted to jump up and down. You know, it's every little step that we celebrate, not just, you know, the big things. Just we need to celebrate every step of the way and encourage the families to do so too. And another huge point is that you should never take away somebody's hope. I don't believe there's anything called false hope. The hope is for the best and whatever outcome that may be. It may change down the road, but always encourage patients' hope. But so I had a big midline incision from here to here, and I'm not sure when I heard a comment over me, but I did hear a comment that somebody leaned over and said, "No more bikinis for her," which, you know, might have been true, but it wasn't the time or the place to say it. And I was paralyzed and sedated, and I wanted to scream, but I couldn't. But it's something that has stayed with me for a long time. You come to kind of know people's voices, their dialects, the way they touch you. And some caregivers are actually really gentle. Some are sort of rough with you. So you kind of get to know who's who just based on how they treat you. And we all need to remember that there's always a person that is trying to come back to what they used to be. And it's the family who knows all the things that make them tick and the things that will encourage them to come back and to want to be back. Actually, the friends from Michigan did that. I had friends from a hotel that I worked at, and they also sent a tape. And my friend who worked at Channel 8 also sent me a tape, and it was very, very effective. In fact, I heard one tape, and it was the first time that I opened my eyes. The story about Marianne is very powerful. She was a co-worker of mine at the time, and she had moved away to LA, and I hadn't seen her in quite some time. But after this whole experience was over, when I finally got home to my apartment, well, I had been asking my mom, "Where's Marianne?" And my mom kept saying, "Who's Marianne?" She didn't know all of my friends that I had, and there were some limitations to people who could visit just because they had to do that when I was really sick. So finally I stopped asking my mom, and I finally waited till I got home. I got to my address book. I found her number in LA, and I called her. And I said, "Marianne, you were at my bedside, and you were holding my hand, and you were talking about sunsets." She verified that that was in fact true. And no one knew. No one knew about that. My mom didn't know anything about it.
She had come in.
She had kind of snuck in. Yeah. But the fact that I remembered it was her, and the content of what she talked about was pretty powerful. And no one knew, but I knew. Okay, I am just really grateful to everyone. And there was hundreds and hundreds of people who helped me through all this. One of the biggest things that some of us forget, I think, sometimes is that when you have a traumatic experience, it becomes a part of you forever. And if you think about some of the patients that we take care of, it's important to remember that. But for me, you know, it's been a long time, but I can be brought right back to my ICU experience by something simple. Even just the smell of the tape they use on the ET tubes will bring me back. And the sound of suctioning will bring me right back. And even when I had recovered and I got married and I was on my honeymoon, and this was 5 years later, I tried to snorkel, and I had a major panic attack because I was brought right back to the ICU with a tube in my mouth fighting, and I just couldn't do it. So, I mean, everybody's experience is different, but for me, I can tell you a lot of these severe things that happened with my trauma will stay with me forever. And also the way I was treated by my caregivers, positive or negative, it will stay with me for a long time. It's the human side of what we do is more important than any other thing. And a quote from Awakenings sums it all up pretty well. And it says, the human spirit is more powerful than any drug, and that's what needs to be nourished. We are the gatekeepers to a positive or a negative experience for the patient. We're the advocates who make things, help them through very difficult times. And it's a privilege and it's a sacred honor that we get to witness these unbelievable transitions for people. They're in critical moments, they're in traumas, their life is turned upside down, and we're the ones who get to witness these events and to help them through.
We'd like to thank Connie for sitting down with us and sharing with us her experiences as a patient in the ICU and throughout her recovery. We're grateful for her and for her experiences as a patient and for sharing this very personal part of her life with us. We hope that the things that she shared with us will be able to be taken into our daily lives as nurses, as caregivers, healthcare providers, and be able to make a difference in each patient's experience, recognizing them as an individual and the role that their family plays in their healing.